Welcome to your cat's neuter discharge video. Along with this video, you'll also receive a set of written discharge instructions that you can refer back to. Please remember that every pet's recovery is a little bit different, but we're here to help and answer any questions you might have to ensure his recovery is as smooth and stress-free as possible. Your cat is going to go home with a medication today called meloxicam. This is an oral liquid medication. It treats pain and inflammation. His first dose is going to be due 24 hours after the surgery, and then you follow with one dose every 24 hours until they're gone. To give this medication, you simply pull the top off of the syringe, place the tip of the syringe in your pet's mouth, and press the plunger. If you're unable to give the medication in that way, you can also empty one syringe into a small amount of really tasty wet food, mix it really thoroughly, and ensure your pet eats all of it to get his full dose. It's very important that this medication be given after food, so please make sure your pet eats first before you give this medication. If you do find that there's any vomiting or diarrhea that occurs after taking this, please stop the medication and give us a call. In terms of feeding, some cats like to eat right away when they get home after surgery. Other cats might not have a very good appetite for 1 to 2 days. Both are completely normal. When you do get home the evening of your surgery, please offer half of his normal meal amount. This is to make sure he doesn't eat too much too quickly and risk vomiting. Now that your cat has been neutered, weight gain is very common. We do ask that you measure out his food each day and just monitor his weight closely, making sure that he's not running the risk of becoming obese. After he's done recovering from the surgery, if he's still eating a kitten diet, it would be a good idea to transition him onto an adult cat diet. But please keep in mind that any diet change needs to happen slowly over 5 to 7 days to avoid any gastrointestinal upset. Another thing to note is that your pet has been fasted for about 24 hours. That, paired with the drugs that we send home, all contribute to slowing down the gastrointestinal tract. It's pretty normal for some cats to not have a bowel movement 1 to 2 days after surgery, but everything should go back to normal after that period of time. When you get home the evening of your surgery, please make sure that you have somewhere safe and quiet for your cat to recover. It's not unusual for cats to be a little disoriented after surgery. They can express extra vocalizations, they could be a little restless, and they might be a little unsteady on their feet. So please be mindful of them around stairs or any high furniture. We don't want them to lose their footing and risk an injury. It's also very important to keep your cat quiet for the next 14 days. If you have children or small animals in the house, it would be a good idea to have him set up in a bathroom or a bedroom away from that busyness. Make sure he has access to comfortable bedding, his litter box, food, and water. We do want to keep him as calm as possible for the next 2 weeks, so if you can tuck his toys away, don't instigate play, and try to discourage running and jumping as much as possible. If your cat goes outside, it's very important to keep him indoors for the next 14 days. Please check his incision sites daily for any signs of irritation. This can include redness, discharge, or swelling. If you see anything that you're concerned about, please give us a call. It's very important to not allow your pet to lick or chew at his incision sites. This is the #1 reason we see pets back for post-operative complications. The most important thing to make sure of is that your pet does not chew or lick at his incision sites. So in order to prevent this, we are sending your cat home with an e-collar, also known as an Elizabethan collar or a cone. This cone must be in place for the next 12 to 14 days while his incisions heal. You are allowed to remove the cone for short, periodic breaks as long as he is under direct supervision. Anytime your cat is not directly supervised, this cone needs to be in place. There were no sutures used for his procedure today, so there's nothing that we have to remove. The incision sites will heal naturally on their own. Provided your cat has no new health issues, for the next 12 months, you can purchase flea and tick prevention from us. You can also schedule annual checkups or vaccine appointments. Thank you very much for choosing our veterinary hospital.